So excessive inflammation is widely appreciated to be an unifying component in patients with many chronic disorders, including hepatic vascular dysfunction. So therefore it is important to understand the endogenous control point within the inflammatory response, so which could provide us with a perspective of disease pathogenesis and for the new treatment opportunities. So portal hypertension is a yearly and a relentless event that occurs in patients with all forms of liver injury, so which causes morbidity and mortality in individuals with cirrhosis. So in cirrhosis, portal hypertension is associated with hepatic inflammation, which contribute to reduced endothelial nitric oxide synthase activity. So a very recent study has been pointed out that exogenous ammonia causes hepatocyte apoptosis mediated liver injury. However, it is unknown whether hyperammonemia induces an inflammatory response, thereby causing decreased enos in cirrhosis with portal hypertension. So Raul has been already mentioned about this ADME DDH pathway. So anyway, I just want to go through quickly. And enos driven NO is an important vasodilator which maintains endothelial cell function. ADME is an endogenous inhibitor of enos which is synthesized from L-arginine during the L-arginine undergo methylation in proteins, and during proteolytic cleavage this ADME is synthesized by the enzyme protein methylarginine transferase, so which is the endogenous inhibitor of all three isoforms of enos. So DDAH1, so dimethylarginine diaminohydrolase, which is a tightly regulated ADME. And we found that in liver cirrhosis there is increased ammonia concentration. So what happened that increased hyperammonemia? So and what's the effect of hyperammonemia in enos function? So L-ornithine phenylacetate, it's nothing but it's a equimolar concentration of L-ornithine and phenylacetate, which has been invented by our group and which is an important ammonia scavenging agent. So in BDL rats with hyperammonemia, we have previously shown that increased brain ADME, reduced brain enos activity and associated NO production, and reduced brain DDH1 protein expression. And following treatment with ornithine phenylacetate to these cirrhotic brain rats, so we revert these indices, which means that OP treatment significantly reduced brain ADME and improved DDH1 protein expression. So we wanna. So the question is ammonia involved in the regulation of hepatic enos dysfunction and associated portal hypertension in cirrhosis? And what the role of ornithine phenylacetate, whether it has any impact on this pathway. So our hypothesis was to correcting hyperammonemia with ornithine phenylacetate will reduce hepatic NF-kappa B and increase intrahepatic NO availability through modulation of these inflammatory dependent inhibitors of enos and reduces portal pressure. So the aim of our study was to determine whether reduction in ammonia with OP improve hepatic enos activity and associated portal pressure reduction in cirrhosis. The questions are: is hepatic inflammation reduced following treatment with OCR002, or interchangeably I'm using that this is also called OP, to cirrhotic animals? Does a reduction in ammonia with OCR002 restore hepatic enos activity? Is this effect of OP mediated through modulation of the ADME-DDH pathway? So let me come to methods. So we have been used Sprague dolly rats 4 weeks after BDL with and without, and after 4 weeks the BDL animals were randomized into two groups, BDL plus vehicle and BDL animals that received OP for 5 consecutive days at a dose of 0.6 gram per kg intraperitoneally. So these are the measurements we made, and arterial ammonia and biochemical parameters by Cobas analyzer, and NF-kappa B, INOS 4-HNE enos protein and DDH1 protein expression by Western blotting. Plasma and hepatic TNF alpha were measured by a FACS bead array, and enos activity is measured by enzymatic conversion of L-arginine into citrulline, and portal pressure measured invasively with appropriate flow probes and software. So coming to result, this table shows the effect of OCR002 on plasma biochemical parameters, arterial ammonia concentration, and pro-inflammatory cytokines such as TNF alpha. You can see here in BDL animals, arterial ammonia, hepatic injury marker, and pro-inflammatory cytokines are significantly increased when compared to sham animals. And following treatment with ornithine phenylacetate, the ammonia concentration is significantly reduced, and the similar pattern also observed in ALT and TNF alpha concentration. So next we looked at some inflammatory markers such as NF-kappa B, INOS, and TNF alpha protein expression, and you can see this figure that shows that NF-kappa B expression is markedly elevated in BDL rats compared to sham, and following treatment with ornithine phenylacetate, it's markedly reduced that phosphorylated NF-kappa B expression. Similarly, increased INOS expression in BDL animals also reverted by following treatment with ornithine phenylacetate, and undoubtedly the TNF alpha concentration, hepatic TNF alpha also significantly reduced following treatment with OP2 BDL rats, so compared to BDL alone. So that we know that oxidative stress marker, oxidative stress also another important driving force for the pathogenesis of full hypertension, and 4-HNE protein adducts is one of the important oxidative stress marker, and we found that 4-HNE protein expression was significantly elevated in BDL animals compared to sham, and following treatment with ornithine phenylacetate, this 4-HNE protein expression was significantly reduced. Interestingly, the increased ADMA in BDL animals was not changed by the treatment with ornithine phenylacetate. However, the other endogenous inhibitor of enos such as caveolin-1 is significantly downregulated by OP treatment. Furthermore, the DDH1 expression is markedly decreased in BDL animals compared to sham animals, and OP treatment significantly restored this DDH1 enzyme function. And importantly, the enos enzyme activity also decreased, is improved with OP treatment, and this figure shows that effect of OCR002 on hepatic enos activity and protein expression. You can see here that the BDL, the enos activity is significantly decreased in BDL rats despite increased protein expression, and following treatment with OP to these BDL cirrhotic animals restore that improve enos enzyme activity without changing in enos protein expression. So I would like to draw your attention in this particular slide that you can see here that portal pressure is significantly increased in BDL animals compared to sham, and following treatment with OP, the portal pressure was significantly reduced. So as I mentioned earlier, that enos driven NO is important vasodilator, and which maintain normal liver function. So what happened during cirrhosis? In cirrhosis, there are increased ammonia, and increased ammonia concentration also elevated increased NF-kappa B, and ADMA. That ADMA is important endogenous inhibitor of enos, which results in decrease in nitric oxide and increased hepatic resistance, and endothelial dysfunction, thereby causing increased pole hypertension. So following treatment with ornithine phenylacetate, so which scavenging ammonia, increased ammonia, and which results in a decreased NF-kappa B and also associated inflammations, which results in improved enos function. Thereby it increases nitric oxide production and decreased hepatic resistance, improved endothelial function, and resulting in decreased pole hypertension. In conclusion, Mr. Chairman and ladies and gentlemen, our study is the first indication that there is an association between hyperammonemia and pole hypertension in cirrhosis. Treatment of hyperammonemia with OCR 002 reduces hepatic inflammatory mediators and thus the severity of pole hypertension in a clinically relevant model of cirrhosis. So we observed restoration of the hepatic enos activity and expression of the enos regulator, which may be mediated through amelioration of inflammatory response by OP. Thus our data provide the rationale for evaluating OP in the treatment of hyperammonemia induced hepatic injury and pole hypertension. Thank you very much for your kind attention.